Your health, your wealth. Health Unpacked is brought to you by Tebelopele Wellness Clinics.
Right, let's get into our conversation for today with our guests here, both on the line and in studio. We're going to be talking about emergency contraceptives, or popularly, called morning after pills. So we're going to be getting into this episode today of Health Unpacked with Tebelopele Wellness Clinic, who has invited Humana People to People, or HPP Botswana, who are their collaborative partners in the health and wellness services that they offer. So we're going to be introducing here in the studio Tebelopele Nichenge, who is the technical director at Humana People to People. A good evening to you, Bill.
Hello, Tumisang.
Are you well?
I'm okay. How are you?
Great. Well, nice to have you in the studio. And online, or on the line, I have Susan Leposo, who is a nurse counselor at Tebelopele Wellness Clinic. Susan, good evening to you.
Hello. Good evening, sir.
Are you well?
I'm fine, and you?
I am great. Thank you for joining us.
Thank you so much.
Okay. Well, let's start with you, Opelo. Perhaps you can briefly introduce to us who Human People to People Botswana are.
Thank you so much, and Dumela. Humana People to People is a non-government organization.
Yes.
We are currently running 6 projects, and one of them being the TCE, which is the biggest project that we are running. So the history of Humana is that it started in Zimbabwe, and in Botswana we started off implementing the TCM project, Total Community Mobilization. So HPP coming into Botswana, it was actually the brainchild of Remogai, because after benchmarking and seeing that the TCM project was actually producing results in other countries, so he thought that maybe HPP bringing that project to Botswana would actually make an impact.
Yeah.
So we started operations in 2001, and we are still here.
You're still here?
We are still here.
Yes. Great.
So HPP is driven by a slogan that says that only the people can liberate themselves from the epidemics. And because we are a community partner, really, our strength is in the communities. We work with communities. We are able to reach even the fairest of places that other people can't even reach. So for us, that is basically our strength. And we are also aligned with the international UNAIDS 95-95-95 strategy. 395s.
Yes.
So the first 95 basically saying that those who are HIV positive should know their status.
Yes.
So basically encouraging that they should test and they should know their HIV status. Then the second 95, we are saying that those who are HIV positive should be taking antiretroviral therapy,
yes,
ART. Then the last 95, we are saying that those who are HIV positive should be virally suppressed. And for us to achieve that, basically, is us making sure that they stay on treatment. And we offer a wide range of services, ranging from care to HIV prevention, targeting families of orphans and vulnerable children, as well as adolescent girls and young women. So we are in different places, all the way from Kasani, Pikwe, Ramotswa, Masunga. So we are almost everywhere in the country. Yeah. All the way down to Bo Francis Town, Good Hope, and Kanye. So we are widely spread.
Yes.
Yeah. So that's about it in terms of HPP.
Okay. Well, thank you so much for giving us insight into that, and telling us a little bit more about Humana People to People Botswana. Let's get to you, Susan. And for you, I would like for you to give us a working definition of emergency contraceptives. What are emergency contraceptives, really?
Thank you so much for the question. Emergency contraceptive. Am I audible enough?
You are very audible.
Thank you. It's a bed commonly known as morning after pill.
Yes.
Yes, it's a contraceptive method used to prevent pregnancy after a known or suspected failure of contraception or unprotected intercourse, including consensual or forced sex.
Okay.
Yes.
So,
in short, it's a birth control measure
yes,
used after sexual intercourse to prevent pregnancy.
yeah. I guess I'm interested in knowing why it is referred to as an emergency contraceptive.
Yes, it's an emergency because it is used within 72 hours, whereby you had an unprotected sex, then you don't want that to conceive or to have a baby when you are not ready for conception.
Right. So in situations perhaps of unintended pregnancy.
Yes.
Okay. Now, who's eligible for emergency contraceptives, specifically looking at services provided by Tebelopele Wellness Clinic?
Yes. Any woman or young woman, adolescents, girls in the reproductive age is eligible for emergency contraceptives, whereby there was a condom broke or inconsistently using condom, rape cases, unconsented sex, and whereby somebody is not using contraceptives anyhow.
Yes.
And is not ready to have a baby.
Okay. And then how soon should the morning after pill be taken? You're mentioning 72 hours. That's the window within 72 hours. But how soon after the fact?
Yes. Like I said before, it has to be used within 72 hours. Immediately after having sex, realizing that you are having that problem, you have to start using it if you have it.
Yes.
Or you go to the nearest clinic and ask for it. It has to be used within 3 days so that it can be effective.
Right.
Yes.
Okay, and you have preempted my next question. How effective is the morning after pill?
Okay, yes. It's 89% effective if used within 72 hours. But if you use it after 72 hours, the effectiveness reduces. So there is high chance of getting pregnant.
Hey. 89% B plus gonna get minus one. Susan.
The percentage, yeah, effectiveness.
I guess what I'm trying to say is that should one be confident in its effectiveness?
Yes.
Okay.
Okay.
And then the side effects, maybe some of the known side effects of taking morning after pills.
Of course, like any other drug, the morning after pill or EC, it has side effects. And these side effects are not signs of illness and do not last long. Most women do not experience side effects. But yes, there are side effects. Someone can experience nausea, dizziness, fatigue, headache, breast tenderness, but they don't last long. So we shouldn't be afraid of taking EC.
Right. And then is it okay for someone to frequently take morning after pills? Are there any issues of drug resistance or ineffectiveness?
There's no drug resistance when frequently taking the EC. You can take as long as you want, and it's very effective. But when we see somebody frequently visiting our clinic or taking it, we advise for the client to take the permanent contraceptive.
All right.
Yes.
Okay.
Because sometimes you'll be wanting the morning after pill whereas the clinics will be closed by that time.
Yes.
Or it's a holiday. You understand?
Emma.
Yeah.
Okay. And then the last question before I return to Pelo here. Where can people access emergency contraceptives?
Yes. In our NGO, Tebelopele, we have 3 clinics countrywide. We have a clinic in Francistown. We have a clinic in Gaborone. We have a clinic in Mulepolole. And anyone can access this EC in the government facilities, clinics and hospitals.
Hey.
Yeah.
Ga go go nna le lecture nyana pele ga motho a hiwa.
When accessing the emergency contraceptive, you are being consulted by a clinician. Obviously, you'll be counseled on it.
Yes.
There will be education.
Right.
Yes.
Hey.
Health education on the EC.
Maybe la ba
and how to take it.
Ha be go itsa pela ga ile gore you are a frequent user of the morning after pill.
I wouldn't speak on behalf of other colleagues, but our NGO is really taking care of that time.
Right.
Yes.
Okay, well, thank you, Susan, for giving us that elucidation. Now, turning my attention back to you, Opelo. For you, maybe you can take us through the support process with Tebelopele, how you work alongside one another to provide emergency contraceptives to those who are eligible.
Okay. I just want to start off by saying that our support as HPP has been made possible by the generous donation of the American people. So what we do as HPP in supporting Tebelopele is that we create demand for clinical services, including the ES pill,
yes,
as Susan has already mentioned. So we work with community health workers who are the food soldiers. So in them going out to communities, they start to share information about the benefits of accessing clinical services. So as they meet with the different beneficiaries within our areas of operation, as well as those that we work with as Tebelopele, they make sure that they give such information about the services. So once a beneficiary feels that they need that service, we do what we call accompanied referral, where we make sure that we go with the beneficiary to the point of service and they're able to get that service. In situations where now the beneficiary can't go alone, we make sure that they don't miss out on that opportunity. So the whole purpose of now us having that referral system is to ensure that we don't lose people in the referral system. Because as you already know, sometimes when you reach or when you seek services, you get lost in the process. So us going with them to Tebelopele, we make sure that they reach the facility and they get the services that they need. We also have combined activities where now we do what we call one-stop shop,
yes,
where we come together and make sure that the services are provided in one place, such that the beneficiary doesn't travel long distances for services. And as I have already mentioned that we are a community partner, really our strength is reaching people who are in faraway places. So Tebelopele follows us where we serve people and are able to provide services. And since we work with children, Tebelopele also helps us to identify vulnerable children, whom we then provide various services to.
Yes.
And through the DREAMS program, which stands for Determined, Resilient, Empowered, AIDS-Free, Mental and Safe, we are able to reach out to adolescent girls between the ages of 9 to 24. So through the various forms of services that we offer, Tebelopele is able to come in to offer education on clinical services, including ES and how the girls can access them. And as HPP, we refer HIV positive clients to Tebelopele so that they're able to get the ART medication. And we also make sure that those that have defaulted are brought back to care. So that is basically how, as HPP and Tebelopele, are able to collaborate and make sure that our beneficiaries and communities are able to get the services that they need.
Okay, thank you so much, Opelo. And in a short moment, I will be asking for advice that you can give to the public as HPP and in your capacity as a collaborative partner of Tebelopele. Back to you, Susan. Just before I afford you that same opportunity, I want to get it absolutely clear here.
Yes.
These morning after pills are readily available to those who are eligible to take them. That is to say, there are no issues of illegality of being given the pill.
Thank you so much for the question. Definitely, they are readily available in our clinics, Tebelopele clinics. We open from weekdays is from 7:30 to 5 o'clock. Weekends is from 8 to 1 o'clock.
Okay.
So it's readily available.
Right. I don't need a script to be given the morning after prescription.
No. You don't need it. You are just being consulted.
Yeah.
And we will be educating you. And there are more services that you will be gaining again in Tebelopele. When you go there, not only the EC, there are a lot of services that one can gain from Tebelopele.
Right. I just needed that confirmation from you. And then maybe an opportunity to share any advice pertinent to the general public.
Thank you so much. I would urge the public to come forward for EC. It's readily available in Tebelopele, all the centers, Gaborone, Francistown, and Molepolole, because it will help protect against risk of pregnancy. It will prevent unwanted pregnancy, enable the woman to avoid pregnancy if sex was forced, and reduce the need for abortion. You know, we have illegal abortion that has been going around in Botswana because abortion is not legalized. So they do illegal abortions. So it's better you take EC to prevent that, because illegal abortion, it has some complications.
Right.
So to avoid complications, you need to take EC, readily available, Tebelopele.
Yeah, I like that. I like that the qualification is there, readily available. Thank you so much, Susan. Let me give you the same opportunity, Opelo, before we part ways.
Okay. My last piece of advice is that as much as we are still dealing with COVID, it's important to acknowledge that there are still other epidemics that we need to deal with. And HIV is still one of them. So we need to make sure that clinical services are availed to everyone, and they should be provided without discrimination. So I would say that we need to make sure that we reach all the facilities that we can so that we are able to get those clinical services, including ES. Thank you so much.
Thank you so much. And that is Opelo Nichenge. Did I pronounce your name right?
You did.
Okay. Thank you so much. And you, of course, are the technical director, Honeka Go Humana People to People, Botswana. And on the line, we were joined by Susan Leposo, who is a nurse counselor at Tebelopele Wellness Clinic. Thank you so much, Susan. Have yourself a beautiful rest of the evening.
Thank you so much. Thank you so much, and goodbye.
Okay. And of course, this program is co-sponsored by PEPFAR, USAID, Tebelopele, Tebelopele, as partners in this endeavor. Thank you so much. Have yourselves a beautiful rest of the evening.